Now you can hit start, but don't. And we're still filing in, so just everyone hold on to their hats. Great. So I think we'll have others joining, but this is we've got a base in here. So I'm going to go back into Tech World and hand it over to Joanne.
Well, hello, welcome everybody. My name is Joanne Garlow, and I'm your moderator for this evening. And I am welcoming you to the first of 6 sessions that will be talking about homelessness in DC and various aspects of the crisis that's going on. So tonight is going to be about COVID and talking about the impact of COVID on the homelessness community. But we're going to start with an introduction to the series from our fearless leader, Nick Manning, who has so expertly organized this entire group of people. So thank you, Nick.
Thanks, Joanne, and good evening, everybody, and welcome to the 70+ people who are registered for this series. So my name is Nick Manning. I've been a local resident for some 22 years, despite my accent, and I've been coordinating the DuPont Circle Citizens Association Homelessness Committee for the last few months. A quick note just about the committee. I mean, this series is the product of the hard work of Jerry Schwinn, Diane Quinn, Glenn Engelman, Joanne Garlow, Kate Coventry, Kerry Kemp, Robin Diner, Robin Nunn, and Tim Norman. And it's all been made possible by the operational support provided by Erica Rickle. Now, as you will have seen, the sessions are going to cover quite a bit of territory in this immensely complicated and heart-wrenching area, mainly focusing on single people who are homeless. And just let me say at the outset that we don't have a pre-cooked proposal for responding to what is an evident crisis. We don't know the best way forward, but we do know that what is happening right now is either not optimal or not enough, or likely both. So what's the purpose of this series? Why are we doing this? And our idea is to provide information and informed views so that at the end of the series, as citizens, as neighbours, as local residents, as housed people and as unhoused people, we're all in a better position to make our own decisions about how best to help, how best to campaign for change, and how best to support progress towards ending homelessness. So we want, as DCCA, we want a community that's engaged and activist and positioned to lobby or take action on the basis of facts. Very briefly, I'm just going to provide a very, very quick run through the forthcoming sessions. So tonight, as Joanna has said, and as you know, we're looking at what additional difficulties and what further trauma COVID-19 has added to the lives of people experiencing homelessness. Next week, on February the 18th, we're going to look at some of the roots of homelessness. What's the arithmetic of the need for affordable housing and its availability, and why is there an imbalance? Has race played a part in that arithmetic? On March the 4th, we're going to talk about psychological challenges and substance abuse. And cause and effect is a real conundrum here. There is a higher incidence of such needs amongst people experiencing homelessness, but homelessness in itself has severe psychological consequences. On March the 11th, we're going to review the importance of permanent supportive housing in moving people from sidewalks to safe homes where they can rebuild their lives. That means homes that are more than just bricks and mortar, homes that offer real support. Then on March the 18th, we'll look at policy in DC and whether recent approaches have been successful in addressing homelessness and increasing the availability of affordable housing. When politicians throw numbers around, we've spent X million on this or a further Y million on that, how should we think about the scale and effectiveness of that spending? And we're going to conclude the series on March the 25th by hearing the experiences of LGBTQ youth and from women who've experienced homelessness, looking at the very particular challenges that they face. So just to emphasize, our purpose in this series is to help all of us reach informed views about where we can and should go from here. I'm now going to hand back to Joanne Garlow, our moderator for this first in the discussion series. Joanne, thanks a million.
Well, thank you, Nick. Thanks for all your work on this. And I want to give a special shout out to Carrie Kemp, who did organize this. I'm just talking. So again, my name is Joanne Garlow. I'm a resident in DuPont Circle. I live off of New Hampshire Avenue. And I'm a homeowner there. And I also have been involved in homelessness through volunteering with a lot of the organizations downtown and through my church, Founder United Methodist Church, where I work on their homelessness committee as well. But tonight we are going to be focused specifically on COVID-19. And, you know, all of us have seen the challenges that COVID has forced on our lives. And perhaps no one has been hit harder than people who are chronically homeless. In the District of Columbia, people who are homeless have experienced disproportionate rates of COVID-19 infections and death. And then shelters have turned into potential contagion zones, forcing some people without homes to uproot their usual living situations and move into tents on the street. And we've all seen the tents all over our streets in DuPont, as well as throughout the city. And community service providers and government agencies have struggled to provide food and shelter and healthcare, masks, bathroom facilities, quarantine hotels, and permanent supportive housing for people who are homeless. So we've asked three panelists with very diverse perspectives to come and talk to us tonight about their own experiences and what they see as what we can do. So I'd like to start with the panelists. If you'd introduce yourself, talk a little bit about what you do in your situation, that would be really helpful. Why don't we go ahead and start with Catherine, if you don't mind to go in first. Oh, you're muted.
Hello. Great. Thank you so much. Thank you so much for having me. I'm happy to be here talking about such an important issue. So I'll just start by saying that I am a DC resident and a DC native. I grew up north of DuPont Circle. My father used to run and bike to work, which was either in or south of DuPont Circle. And in the mid 80s, we saw the kind of explosion of homelessness on the streets of DC. And that's actually when I first got interested in this issue. And as a medical provider, I have been working for Unity Healthcare for the past 11 years, working exclusively with people experiencing homelessness in DC, both in shelter-based clinics, clinics and day centers, and also doing street outreach medicine in DuPont Circle, among other places. And it's in that capacity that I have been working really with the Department of Human Services and Dina specifically over the past few months since the pandemic came about, and I look forward to talking to you more about it in a little bit. But that's sort of my background.
You know, since you were already lightly introduced, can you go next, please?
I'd love to, and thank you for having me here. This will not be the only time you see me. As I heard about the topics that will be discussed later in the month, I will be back if invited as a listener, so thank you. I am the Director of Policy and Program Support for DC's Department of Human Services. My background is in public health and Medicaid finance, and I've been with DHS for about 5 years now. So really excited to talk about all the things that DHS has done through the public health emergency, and to also share great things about the partnership with DHS and Unity. Catherine and I talk every day, all day, about the best ways to serve our neighbors.
Thank you both for all that you do. And our third panelist is Reggie Black. Reggie, if you could give your quick introduction to yourself, appreciate it.
Yes, hello everybody. Can you hear me?
Yes.
Okay, all right. My name is Reginald Black. I have many roles in districts with different organizations. I'm a native Washingtonian, as I said before, and have actually experienced housing instability for a number of years, and I've been involved in some of the policy related and other works that Ms. Hassan and Ms. Crossan has referred to. And today I actually serve as a consumer representative for people who are unhoused right now.
Thank you, Reggie. Okay, so I'm going to ask a couple questions, but I'll let most of you talk. But I also point out to anyone who's attending, if you ever have a question, go ahead and put it in the chat. And when there's a pause, I'll try to ask the questions, okay? All right, so for all of you, my first question is just, can you talk a little bit about what you have experienced personally in your work or in your life, working with people who have housing instability during this time of COVID, and how COVID has affected the work that you do? Let's go ahead and start with Dina this time. Dina, you want to start?
I think that this public health emergency has been an eye-opener for everyone. I think that the things that we used to take for granted, we don't anymore, from our livelihoods to just life itself. So from this public health emergency, I've seen the resiliency of our homeless populations, unsheltered and in shelter. I've witnessed the generosity of our neighbors in trying to help. I mean, it's been a life-altering experience. I think that, our neighbors like Reggie and others, I mean, I see Reggie all the time too. I mean, he's very active, and he isn't the only one. There are, I've witnessed just the generosity within the homeless community. Most recently last week, and Catherine can talk about this more too, we had our COVID peer educator program where we have those experiencing homelessness speaking up to say that I took the vaccination, this is what happened to me, and to answer some of the questions that a lot of our clients have.
Awesome, thank you so much for sharing that. Catherine, do you want to go next?
Sure, yeah. So I think that for me, we talk in the medical homeless medicine world about the fact that housing is healthcare. And I think that there has been no time in my professional career that has been more driven home, that housing truly is life-saving. Every single person that I care for, whether it's on the street or in a shelter or in a day center, would be able to protect themselves and from COVID and from getting, the complications of COVID and dying from COVID if they had a safe place to go and quarantine effectively. And not only that, but if they got sick, they would have a place to go and isolate and then protect not only themselves and recuperate in a safe, healing environment, but then also protect the rest of the community. And in the current situation where we have large congregate shelters and people living, sometimes 60 or 100 people in a room in bunk beds that are stacked 2 feet apart, it really is sort of a nightmare scenario in terms of massive outbreaks. And that is the real kind of panic that gripped all of us in caring for this population when COVID first presented itself. And so we scrambled with the Department of Human Services, who I just cannot applaud enough for really stepping up and trying to sort of be creative and advocate effectively for resources for this population in just a terrible situation. So what that looked like. So I've been a medical professional for 20 years, and 11 of those have been working with people on the street, literally doing street outreach in day centers and in shelter-based clinics. But most recently, I've been working with the Interagency Council on Homelessness as Unity Healthcare's organizational representative. And so I felt fortunate to be in a position to partner with the Department of Human Services and the ICH to kind of create these solutions for really vulnerable people living in congregate settings. And I don't know how much I'm supposed to go into now, but that's when COVID, that's how it's changed my life in terms of the work that I'm doing day to day. So rather than working in shelters and on the street and in these day centers, I'm now in a temporary role as the medical director for all of the emergency response sites, which are the hotels that serve two purposes: the isolation and quarantine hotels, where people experiencing homelessness can go if they either have COVID and so they need a safe place to isolate outside of the shelters and not only heal for themselves, but protect their communities from exposure. The isolation and quarantine hotels also are for people who've been exposed, close contacts, these people who are, the folks who've been identified as sleeping 2 feet away from that known COVID patient, and then also people who have COVID-like symptoms, which, and they need to go someplace and get tested. The other hotels that I am so grateful for DHS to advocate for and stand up are hotels that proactively protect those who are most vulnerable to complications and death from COVID, including people who are older and very medically vulnerable. So there are now 3 hotels across the city that serve upwards of 650 individuals who are in their 60s, 70s, 80s. We have 2 gentlemen who are 86 and 87 years old. We've got patients who have cancer undergoing chemotherapy, who are on dialysis, who have end-stage AIDS. And really, this has just driven home to me the medical vulnerability of our neighbors experiencing homelessness in DC. And so that's what I have been doing for the past 9 months, is helping to manage the medical care at all of these sites and working with DHS to, constantly sort of figure out the best next steps. And luckily, the current phase is this vaccination campaign. We vaccinated successfully 426 people across the 3 hotels last week in 4 days. And it was phenomenal to see so much enthusiasm and excitement and interest among the residents to get vaccinated.
I'm going to save a lot of the questions that are being asked to after everybody has a chance to talk a little bit, but one of them just fits in just with what you were saying, Catherine, was the question of what percentage would you say of the people who are experiencing housing instability have had the vaccine or have had access to it? Is it a small percentage? When you talk about 500 people, is that
right?
A tenth of the people, or is it a 1%, 10%?
Well, so I guess Dina could probably speak better to the numbers.
Oh, okay, thank you.
Who's homeless, but we're rolling it out. So go ahead.
We are, and I don't know if I can offer a specific percentage of the homeless population on this call, but I can share DHS's role in the Department of Health's overall vaccination rollout plan and the sites that we're offering vaccinations for. So as Catherine mentioned last week, there are 3 what we're calling PEPV sites, and that's Pandemic Emergency Program for Vulnerable Individuals. At those 3 hotel sites, we had vaccination clinics all last week, where anyone staying there could have access to the vaccination, including staff that were there. Starting this week, we started rolling out vaccination clinics at our large congregate shelters. We had a vaccination clinic on Monday and Tuesday at 801 East, and we have today and tomorrow we'll have them at CCMV. And then the rest of the shelters include Adams Place and Pat Handy and Harriet Tubman and New York Avenue, et cetera. And at those, again, they are for clients who reside there, and then the staff that see them and care for them on a daily basis. So as far as the numbers at each site, I do invite everyone on this call to join our bi-weekly partner calls, where Director Zeilinger over the Department of Human Services and her team presents information on the vaccinations as well as our full COVID response.
Thank you so much. Thanks for that. All right, Reggie, you want to get a little, just to tell us a little bit about your own experiences in this time of COVID, during the pandemic, with people who were experiencing housing instability, just your personal experiences.
So like I'm in my different roles, I'm like a peer, and I'm there to give all kinds of different support, even mentoring support. So one of the things that kind of was changed for me is that we kind of got out early on a few things. We wanted to make sure that there were certain provisions in terms of how people in encampments would be able to be sanitary during this pandemic. And so we've been going there since I think late April. We've expanded to at least 4 encampments, 2 of the largest in the city. I think that for me, it feels like my peers are sort of like more exposed. I feel like the one thing that I think it has taught us is that there is a significant number of people that, for whatever reason, are either not captured by like our counting methods, or they are doing other things, while our like services are operational. So, with so many like other things closed, like cafes and some of the entertainment venues, a lot of people that had these extra occupational based hours who wouldn't show up in our system are now starting to show up as what we sort of like think is our increases to our encampment population. And I just, I just know that these are people we've missed all year, and that they were there even before the pandemic. And like Dr. Crossan was saying, housing is healthcare. And we know that, during this health emergency, that's the best avenue for these folks to social distance and isolate if sick. But yeah, it's been rough for people. We've been, like I said, we especially in the Northeast area, the Noma encampment, we've been going there since April. And it is really having a toll on people. Like I know that a lot of our services and provisions have been instrumental in keeping a lot of our neighbors alive, but they're vulnerable. And it's not just to the virus, they're vulnerable to the elements as well. Without some of these places to go, like a 24-hour restaurant, or these different places a person could be throughout a 24-hour cycle. Most of them closed. Most of those people are left with nowhere to go. And so, without support services, they're not just vulnerable to the elements, but they're also vulnerable to COVID-19, because they cannot safely social distance and self-isolate, nor can they properly sanitize. I think people don't understand that, and that we should kind of be up in arms about, we have let people be in a situation where they cannot sanitize. It's just, it's unconscionable of that. But as Mr. San said before, they're resilient. They have been able to use porta potties and hand washing stations. Some of the grassroots groups have been advocating for, and I think we are a strong community, people who have been or are unhoused now. It's just we need more resources, and I think the number one resource that needs to be elevated is that people need a place to like live. They need a place to go, to make sure that they can properly do these things, sanitize, self-isolate, social distance.
Yeah, one of the questions that was asked that sort of fits into just what you were talking about is about kind of how much access to masks and how much sort of COVID education do they really understand sort of what people need to do in addition to just not having it. Can they get access to masks pretty easily, or is the people that you worked with or you know personally or experience?
If that one is to me, we're providing masks.
Yeah.
We're providing them. We see at least up to 200 consumers a week. And I know we're at least doing 1 mask per consumer. So we're doing, at least 200, 300 masks a week.
Wow.
We do them every week, make sure, and we try to get cloth ones that people can reuse.
Right.
But our most prevalent mask has been the K95 and surgical masks we've been able to obtain.
And we also have been handing out in the homeless medical community, we've been handing out the cloth masks. There have been huge kind of campaigns mobilized around making masks specifically for people living in shelters and on the street. And we have healthcare providers who go to the shelters to see folks in clinic, and also to some of those breakfast programs in the city, Miriam's Kitchen, and also street outreach at McPherson Square. And so we've been trying to pass out cloth masks as well. But certainly making sure that people have access to multiple masks that they can wash and wear and go back and forth, I think is huge. And I couldn't agree more with Reggie's points about the need for increased access to sanitation, washing hands, going to the bathroom, et cetera, which has been a problem pre-COVID for sure. There was a bathroom bill that was passed to improve or increase access to public restrooms in the city that is really would make a huge difference for people experiencing homelessness. And also, I think that, while I think there are people who feel that they're safer on the street from a COVID perspective, in terms of when it's compared to being in these large shelters, I am so worried about folks from a hypothermia perspective, because as Reggie said, the libraries are closed, the day centers are closed, the McDonald's and the Starbucks and the Wawa and all of the places where people would go to warm up, even for 15, 20, 30 minutes periodically throughout the day, they don't have access to those places. And the people who used to be on the sidewalks, offering a cup of coffee here and there, those folks are working from home. And so the sidewalks are much emptier. And so I really, really do worry so much about the hypothermia and people not being able to sort of protect themselves from that perspective.
In addition to that, we've made sure that our personal protective equipment units that we've been giving out, we make sure we have hand sanitizer and sanitary wipes with them, because we know that with some of those places closed, it's hard to get water, and so I know people will use those to bathe and other things. And as far as the females go, we made a special effort to make sure that we get feminine products, so that the women who are unaccompanied and that are living on our streets are able to take care of that piece of their sanitation as well.
I think a follow-up to the question that was asked earlier, Joanne, was about education, COVID education. And that's something that I think is extremely important, and what I've been looking a lot into, because even though we know the vaccination is here, there is a lot of fear, particularly around the brown and Black communities around taking the vaccination. And a lot of that is rooted in, historical misuse and abuse of brown and Black populations, all the way back from Tuskegee, all the way until most recently in Puerto Rico, where women were sterilized. So I think education, culturally competent, culturally appropriate education around the vaccine is still needed. And I think that a lot of organizations are trying to do that. But I mean, as we all know, you would trust a trusted advisor, your church, your friend, your et cetera, more than you would trust a flyer or even a public health professional. So we are looking at ways to get the message across in a way that people would actually listen to and hear. So if there's any, I'm looking at the chats too, if anyone that has recommendations on how we can do that, we'd love to hear that on this call as well. So
I did like that you brought up about how we're using the educators for the vaccine. As part of our outreach initially, we was getting the, guidance from Dr. Crossan's office and others who had been partnering with DC Health. So, there have been phases of education that have been going on. Hopefully I'll be able to help out with the vaccine education, but a lot of the community have been able to process, some of that information. Of course, we reiterate people need to wear masks, and, we're giving them hand sanitizer and, making sure that they understand, not just with written material, but with connections that this is, a serious thing. Where you are is a hotbed of germs, where you're, inside or outside, that it is difficult to constantly wash your hands and do these things. So here are these materials to help you, accomplish these steps that the CDC is asking for, from us. And I think that as part of those conversations with the unhoused, people, have to understand that they don't have a place to go. They're basically forced into an unsanitary situation. And we should be looking at solutions to alleviate that. It is very, very, to me, inhumane to constantly tell people they need to wash their hands. But the majority of the people you see on their streets, where are they going to go to wash their hands if Starbucks, McDonald's is closed? These are the types of things that scream out to us, that these people should have been in housing before this, emergency took hold of our region. Or we should have a better, plan to prepare non-congregate shelters, something to make sure that they are in the best situation possible.
You guys are
Great.
just amazing. Your stories are great, and you're really out there doing things, and we really appreciate it. One of the things that I think we'd like to talk about too is just sort of where can we, what do you see as the thing that we could do the most, that we could help, that we could move things forward? As you look at, and one of the questions particular that was asked in the chat was about the advisory neighborhood commissions, the ANC, and how can they contribute? What can they do to contribute to the response of people experiencing homelessness? They seemed very much focused on things like transportation, land use, alcohol permits, and parks, is the person who asked the question said. So what can we do to use that or use other means to move forward to make things better, especially around COVID? And I'll let anyone who wants to talk. I don't have to direct you guys. You guys all know what you're doing more than me.
So, I mean, this is just, the obvious thing, but we need more housing, right? So I think that and I don't think that the ANC can necessarily solve that problem, but I think that the more people, especially people with, in a position of power and with wealth and with, in a position of advocacy, the more that people can advocate for affordable and extremely affordable, whatever the different sort of layers of affordability are, there needs to be more housing stock that is affordable for folks. There are many, many people living in the shelters who are working jobs sometimes full-time jobs, and they're making minimum wage and they can't afford a place to live. I had a patient who was working in the Capitol. He worked in the cafeteria in the Capitol, making that like famous navy bean soup, and he was living in a homeless shelter. And so I think that, I think that whatever we can do, and if it's not just the three, just me and Dina and Reggie who are like constantly fighting for it, but people who are really welcoming and including people of different socioeconomic backgrounds and skin color, and just a diversity of experience into their communities, and advocating for that sort of diversity of housing stock, I think is hugely important. I think that there's a lot of like NIMBYism, and we've seen that in our time with the hotels. There have been some hotels that have been less well received, I should say. And it's been a little disappointing at times, but I think that that is really just hugely important. So short of housing, I think that there are lots of other things that can be done. Sock drives, socks are so important. I see people with, frostbite and trench foot, and where their feet are just soaking wet, and there's, so having a constant supply of clean, warm, dry socks. Foot and hand warmers are important. Access to public restrooms, advocating for, fighting for public restrooms in DuPont Circle, in Farragut North. I mean, in Europe, they have these lovely public restrooms all over the place. And I think going to the bathroom is not a human right, it is a human function, right? And so patients of mine get arrested because they have to go to the bathroom and they don't have a place to go. And so they go in public, and so then they end up in jail. And, and that makes it harder for them to get housing. So I'm just like going on and on, but so advocating for public restrooms, having sock drives, there are lots of kinds of things that I think can be done. I don't know, Reggie and Dina, I'm sure you have lots of ideas. I'll get off my.
No, I do. I think what you're saying makes absolute sense, but I think what you're saying are things that should have been happening anyway. I mean, what you're advocating for are things that, are needed for our unsheltered neighbors, period. But I want to make sure that we're focused on, what specifically ANCs can do within the public health emergency for homeless individuals. And I'd like to hear actually Reggie's comments on that. I mean, I would say hand out masks and inform about COVID and hand sanitizer, like the normal talking points from public health perspective. But I'd really like to hear what Mr. Black has to say about that.
Yeah, so one is you can look into a group called People for Fairness Coalition. They're actually doing a COVID-19 response and working with mutual aid networks all across the city. So I do suggest supporting some of those efforts. Also, you should take a look at something called the Vacant to Virus Reduction Plan. I don't know if you knew, but during COVID, our own city has reported 10,000 vacant rental apartments in this city. 1/3 of them are Class A luxury units. So, we want to make sure that all of our resources that we've already paid for, which would be a good chunk of these 10,000 units, are being used to further help our community. I can put some websites in the chat if you want me to. Definitely, you want to take a look at some of those initiatives and work with folks who are, interested in addressing housing instability, and more importantly, if you do have people that that are unhoused in your community, the most important thing you can do is do your best to maintain that connection and relationship and help that person form a safety net, because these are the things that are needed to prevent it. And so if we have people in that situation, we should be working to become these safety nets and support networks for people in our community. And I can definitely put our website, the People for Fairness website, in the chat, as well as information about the vacancy virus reduction plan. It actually was created by community members. And so, there's a lot of great research there. And you can find this information at www.v2vr.info. Leads you to the data, the plan, and how we can help our neighbors in this emergency.
We had one comment in the chat. Thank you so much, Mr. Black. I appreciate your thoughts on this, and the websites would be helpful for people to follow up. We had a comment in the chat as well about the ANCs, that there's a comprehensive plan that's being created. It's being voted on right now, that looks at how the city is going to be laid out, and it's going to include language to provide affordable housing for extremely low income and the unhoused. And that comprehensive plan can make a big difference in the next 10 years. They last a long time, so they have a big impact.
Oh my, Joanne, did somebody say comp plan?
Yeah.
Yes, that is another large conversation that's happening right now. There is a lot of things in there. So I don't know if people know, but the comp plan, as we affectionately call it, is about a 20 to 30 year plan to make sure that we have a document that's guiding the physical development of our city. And yes, there is an enormous conversation going around about the comp plan. You should really check that out and get involved into that. There are a lot of things that are going to help those who are unhoused in there, and there are also some things that may not help. And you need to know about what types of policies and action steps are being proposed to be carried out in these different areas. And it's a large document. It touches everything. But yes, it does have places where it talks about our unhoused population and what we are strategizing around in terms of making sure that we have the units we need for them. And there are a lot of groups working on this too. I can send another link around.
Thank you. One of the other questions that was asked is are there any other jurisdictions that DC might look to as for examples of better ways of protecting people experiencing homelessness?
Particularly during the pandemic?
Yeah, during the pandemic,
yeah.
Where you're like, they are doing a great job and this is some things they're doing.
Yeah, and I'm sure that Dr. Carlson will want to add here too. We've all evolved in our understanding of the virus. So our smarts around it and our strategies to prevent it and mitigate risk have evolved as the CDC's understanding has evolved, et cetera. Back in March, when the pandemic started and we were trying to see who's doing it well, what are the best practices, we looked to a number of states, particularly in New York and Connecticut, to see how they were using hotels to spread and reduce the exposure of COVID around persons experiencing homelessness. So some places actually moved the whole entire shelter system into hotels. And others did a number of other things. So what we did was we launched our PETV sites, which one takes those that are most vulnerable from severe COVID, severe complications from contracting the virus to a hotel setting where not only are they in rooms, but they also have on-site medical care, on-site behavioral health care, and someone checking in to see how they're doing on a daily basis. Which has been great. And also, a great thing about that is that by moving people to PETV, they're coming out of shelter that then allows more space within the shelter so that we can have social distancing, et cetera. And then at the ISEC sites, we looked heavily at how New York did their ISEC sites, where we have on-site medical care as well and behavioral health care as well. And then also look to provide like daily activities for folks because they're in a room quarantined by themselves and want to make sure their mental stability stays set. So we're doing everything from like coloring books and whatever it takes to keep people sane while they're quarantined for 10 to 14 days. Did you want to add more to that?
Sure. Yeah, I would love to. I think the one thing that kind of is going through my mind as you're talking is that I just feel like you're not giving DC enough credit, because I truly feel like we were leading the curve for so many of these things. We were one of the first areas in the country that was proactively protecting people who are older and medically vulnerable by putting folks in these non-congregate hotel settings. I think in Connecticut, for example, you know, the homeless population of their entire state is like 2,000 people. So it's a third of what it is for the adult singles in DC. And so, you know, they were putting folks kind of across the board to de-densify the shelters into hotels. But in DC, where we have a much more concentrated population of people experiencing homelessness, we made the decision to proactively protect those people with most risk for complications or death from COVID, with the understanding that we were not only protecting those individuals from complications or death, but we were flattening the curve, right? We were keeping those folks out of the intensive care unit, and we were protecting them from death, and we were protecting all of the communities, as Dina said, by taking folks out and allowing sort of the de-densification of those spaces. But I think that really this experience has been one of constantly learning and sharing and collaborating and sort of repeating. So I work with the National Healthcare for the Homeless Council, and I'm on their Clinicians Network Steering Committee, and have been meeting monthly or more often with clinicians around the country on what they've been doing. And I really have been so proud of DC and especially our Department of Human Services for the measures that they've taken. I think the biggest lesson that we learned most recently, I think, maybe I'm wrong, but from New York and Connecticut, is that they were doubling up the hotels from the beginning. So any room that had 2 beds, they were putting 2 people in it. And we had been pretty conservative, and we were really giving everybody their own room because we were trying to protect them. And we learned from Connecticut and New York that they really had very few cases, if any, even with doubling up. And so we realized that we could almost double the number of people that we offered this very limited resource to if we did that. And so we when we were opening our 3rd hotel for this protective hotels, we made them double occupancy, and then we also backtracked and made the other 2 hotels double occupancy. And it has gone much, much smoother than I had anticipated. I expected a lot of resistance, but I think that people, for the most part, really recognize this is something that, you know, if I were back in the shelter, I would want somebody to welcome me in so that I could have access to this resource. And so I think that there really has been a tremendous kind of sense of we're all in this together. As Dina mentioned, the generosity in the community, within the homeless community, and then also of our housed neighbors in terms of trying to offer and try to figure out what they can do to help.
I just, sorry, I had to retrieve my dinner, but are we still answering that question about what we can learn from other countries, or we moved on to a new one from other places?
Nope, we're still.
Because like I think we need to do some more research into Cincinnati and Boise, Idaho. At when we had about 250 positive cases in our community, they had none. I think that we also can learn from the cities of Oakland and Philadelphia, where community members have, in my view, claimed their right to vacant spaces, and have made it imperative to that particular jurisdiction that that vacant space can be used effectively to house our neighbors and also protect people from COVID. And this is why I know that within our conversations about vacancy virus reduction, uh, uh, these are things that I think we want to try to achieve. Um, and I feel like, through that, through knowing that these particular places were doing things like possibly buying hotels and converting them into housing, and then you had public housing that was converted into housing and repaired by people who were homeless. You had old vacant houses in Oakland that were taken over by an organization of women with dependents, and those houses were fixed up by them and their organization and made a viable space even before the pandemic. But these are areas that we can learn from, and we have the resources to do similar things. We have vacant space. Like we have paid for a significant portion through our Housing Production Trust Fund, up to 10,000 vacant units that are in the city right now, and a third of them are Class A luxury units. So we can be intentional and in some ways forceful about how our tax dollars are being used, and if the product produced by them is being used for this emergency or not.
Can we talk a little bit about those vacant housing units? I'm not sure I understand. I don't know if that's something even Dina, you can talk about, or from the city's perspective, or.
I can't talk about the vacant housing units, but I would invite Reggie to share more. But before we move on, I mean, as we're talking, I'm like texting and emailing my team, like, where's this information? Because I do appreciate that the purpose of this call is to make sure we're sending out as much information as possible. And there was some conversation earlier about hand washing stations and where those are. And we have them posted throughout the district. And I want to make sure I can post in the chat where those hand washing stations are, so we can direct folks to, and then also to share information about the 24-hour opening of our shelters. So I'll get that and try to put that in the chat. I can't answer the question though, as far as the vacant units.
Okay, sorry, I didn't know if you would know.
I'll try to get it though.
Thank you.
So as part of some of, I mean, it kind of was spun out of all of our work on housing, which in a lot of ways sort of like consolidated itself into the work of the comprehensive plan. And people were looking at, well, we've been building all these buildings so long, is every unit occupied? And there were questions about how many vacant units actually were in the District of Columbia. And along comes the Office of the Chief Financial Officer with his, I think it's a revenue projection or some type of report he does at the end of the year to see how well the city has done in terms of different areas, including wages. And it also has a section that takes a look at the occupancy rate and estimation of levels of rental units in the city. And this is where that report is like, that is what spawned vacancy virus, to actually find out that there are a significant number of vacant units in DC. People thought it was 30,000. We actually found out it was 10,000. And the 30,000 is more so for the region. So we know, looking at census data from our own chief financial officer, that there's a significant number of vacant units in the city. So we've come up with a plan. And again, you can take a look at v2vr.info, check that plan out, because this is what we, need to hammer in. We have vacant space. in the district that could be used to help our unhoused neighbors social distance. And like we say, housing is healthcare. So since we've paid for these units, because a lot of the projects we did a little further deep dive on have significant records of public subsidy to, tax abatements, exemptions, also incremental tax incremental financing formulas or TIFs within them. So that means if there are vacant units in the building, we've basically paid for those units to be vacant. And so this is a way to call for accountability on how our tax dollars are being used and products produced with are being used, especially in a health emergency.
So much. We have one last question I think we can squeeze in before we have to go, and that is a simple one. Someone asked, where do we donate socks? So if you have a place that you would say where the socks should be donated, if you could tell us or put it in the chat.
Yes, you can, and I can put some of these in the chat too. You can donate them to us at People for Fairness Coalition, which would be www.pffcdc.org. I believe you could also go to, let me pull it up here. There's also people that are in the mutual aid networks you can donate to, but also if you go to serveyourcitydc.org, you can get in contact with some of our partners that are helping the unhoused and supporting the Ward 6 mutual aid network as well.
And I would add to that other organizations that are doing street outreach. So I think People for Fairness Coalition would be awesome. Miriam's Kitchen also does street outreach. Pathways to Housing does street outreach both in the Farragut area, all across downtown, Noma, and probably DuPont a little bit. Everyone Home DC does street outreach. Unity Healthcare, we do street outreach, but I think that you could create your own sock drive, but and then donate to People for Fairness and have Reggie and his colleagues do some street outreach to folks. I also think that hand warmers are great. Reggie, I have a whole box of hand warmers that somebody like a big container of them. If you guys could use those, somebody just donated those to us.
Cool. We'd love to take those out tomorrow night to State Department.
Great.
only us outreach people know what those names mean.
Okay, well, I think we only have a minute left, and I know Nick wants to say something to say goodbye and thank you, but I personally want to thank you first. Again, all three of you have been excellent tonight. You have showed so much of your time and energy, and thank you for giving up your evening to tell us a little bit more. And Nick, if you wouldn't go ahead and also close us out.
Well, Joanne, thanks very much indeed. And Dina, Catherine, Reggie, thanks a million. I mean, some really excellent points and very heartfelt points, as well as very sort of empirically informed. So thanks very much for that. The reason I just wanted to come back very briefly was that I was warned that my microphone, there was some mess up, some setting mess up earlier on. So I think I was whispering to many. And I really just want to, although at least I didn't appear as a cat. So, but now I just wanted to emphasize that it is a series, right? You know, so this is the first, and it's been a great opening to this 6-session series, and as I was outlining earlier on, we're going to cover in this series, we are going to cover some really important points, as important as this question of how to respond to the pandemic. And next week we're going to be looking at some of the roots of homelessness and some of the questions that have come up in the chat about the vacancy rate and, like, you know, what does it mean to have a housing shortage when we've got that many vacant units? So what's the arithmetic of homelessness in DC, and why is it the way it is? So I really would encourage people to stay with the series, so that we can, by the end, between us, have got a far better understanding of, like, you know, what this very, very complex and multidimensional challenge, what it looks like, and where we might go from here. But thanks very much indeed to you all, and again, you know, it's I think it's been a great start to our series. Thanks a million.
So much.
Thank you so much.
Thank you.
Thank you. And I'll put our websites in the chat again where people can find out more information.
Thank
Okay,
you. Be
thanks.
safe, everybody.
Thanks.
Bye.
All right,
Bye-bye.
take care.